In line with the MDGs set out in the health sector, Ethiopia has been implementing its fourth round health sector development programme, which aligns with the National Growth and Transformation Plan. The major pillars of the GTP of the health sector focus on improving maternal and child health care, as well as prevention and control of communicable and non-communicable diseases such as HIV and TB. Ethiopia's flagship health extension programme has remained a champion approach for maternal and child health intervention, which are major targets of the MDGs. Ethiopia is spearheading with its health extension programme by deploying 38,000 health extension workers in 54,000 localities across the country.
Through the implementation of the health extension program, we've been able to reach the individual households, and we've been able to teach the community that they are able to produce their own health. And also through the health extension program, we've been able to bring all the essential critical health services to the doorstep.
Sheno town is 78 kilometers northeast of the capital, Addis Ababa. In the vicinity of Sheno is the neighboring district, Kimbabet. The health extension program in Kimbabet district is benefiting the communities in every locality of the district. Almaz Girma is a resident of the district. She is months away from delivering her fourth baby.
I gave birth to my 3 children at home with the help of my neighbors. I am pregnant now and have decided to give birth at the health center as a result of the advice I got from the health extension workers.
Zordnesh Muligeta is a health extension worker in charge of Kimbabet district. She identified Alam Gurma in her list of pregnant women for follow-up.
Previously, when many mothers used to give birth at home with the assistance of traditional birth attendants, they were exposed to different problems. But now we are teaching them to go to health centers to deliver.
This is one of the nearby health posts for residents of Kimbabet district. Alam Tashome is here to get her child vaccinated.
I bled much while giving birth in my home, and I was also suffering from a psychological problem at that moment. But now I am better, and I am following up the health of my baby here in the health center.
Previously, only 10% of the total deliveries in Ethiopia were performed by trained health professionals, due to an old tradition of home delivery preferred by many mothers. A number of mothers want to deliver at home because they have limited awareness about the risks of birth, unattended by health professionals, and also due to the allure of traditional ceremonies prepared for a woman delivering at home. In recognition of the cultural practices and values, now new health centre setups include such ceremonies to motivate them to deliver in health centres.
It is my second time that I gave birth here in the health center. I am afraid of giving birth at home because I expect that a birth complication will happen to me.
One of the problems for mothers to die in this country is because they are not giving birth in health facilities assisted with proper health professionals. So, there are different barriers for this, and one of the big category of barriers is the demand side barrier. People are not convinced to go to the health facilities to provide birth. So, there are cultural barriers, there are attitudinal barriers, and this can only be solved with intervening through the development army.
Due to the concerted effort of the health extension workers, societal awareness is being created about the critical values of the nearby health posts for mothers.
We have for long been assisting women who give birth at home, but now I personally advise them to go to a health center for delivery.
The progress every year towards skilled delivery is being increasing. For instance, this year we jumped double in terms of skill delivery rate. It was around 23% last year, but now it's about 41%. So this shows you that the interventions that we are doing at community level is effective somehow.
As part of the global campaign of No Mother Deserves to Die While Giving Life, Ethiopia's health extension program has brought change. For this reason, maternal mortality could dramatically decline in the country and eventually meet the Millennium Development Goals 5.
For the Millennium Development Goals number 5, related to the reduction of maternal mortality, Ethiopia is making outstanding progress, because 70% of the maternal deaths have been reduced between 1990 to 2013. It's mean that in 1990, 871 deaths per 100,000 live births. And almost 20 years later, in 2013, Ethiopia has achieved almost half of death, reducing by 2.
The improvement of rural road infrastructure that connects the majority of rural localities to health centres has enabled many mothers to get ambulance services. These ambulances are useful not only in terms of assuring safety, but also saving the lives of mothers.
Healthy women can take care of their own households, can take care of the society, can take care of the nation in general. And if families, if women are able to produce their own health in their own households, they don't get sick often, and they are able to save the money that would be either invested or spent in some treatment of illnesses and so on.
Ethiopia has joined the list of 7 countries that achieved MDG 4 by significantly reducing the under 5 child mortality rate by 2/3, 2 years prior to the date set.
Since the first health sector development program was launched, and especially after the introduction of the health extension program, just after the conclusion of the first health sector development program, there has been tremendous improvements in terms of child health services, and these improvements are results of community-based interventions, especially community-based interventions that helped children to have a better nutrition, a better hygiene, and also to have all the necessary immunizations.
More than 90% of child and infant mortality is caused by pneumonia, diarrhea, neonatal problems, malnutrition, and often a combination of these conditions. A rapid and inclusive immunisation programme has been made available to every health institution across the country during the 4th round Health Sector Development Programme. The total coverage of the country's immunisation programme has reached 70%, and this has enabled to cut child and infant mortality dramatically.
So the routine immunization service is currently provided almost everywhere in the country. It is accessible. People should not travel for days to get immunization services, since they have health posts near their village. And there is also a health extension worker. We deployed more than 38,000 health extension workers all over the country. And these health extension workers are providing outreach services as well.
Neonatal mortality has remained a challenge in Ethiopia, and more effort is being exerted. Lack of community awareness for newborn care and limited skills of health extension workers to manage newborn infection have been some of the causative factors. A task-shifting study conducted by the Ethiopian Ministry of Health in the Arisi zone in the state of Oromia has resulted in a 30% reduction of neonatal death. The Arisi experience is being shared with other regions.
The newborn intensive care unit, which is also very important in saving lives of neonates, is also rolled out it is established in about 27 hospitals and 16 university hospitals also. The newborn intensive care unit and the newborn corner, they are new initiatives. We are working on them, but we believe that they are going to bring a significant difference in terms of improving child health and specifically neonatal health.
Ethiopia is also attracting global attention for its leadership commitment in advancing family planning health services. The wide coverage of appropriate family planning health services has enabled Ethiopia not only to cut maternal and child mortality, but it also empowers women to have larger gaps between pregnancies.
1/3 of the diseases, the maternal diseases, can be prevented using appropriate family planning method. And so family planning is one of the major interventions in terms of reducing maternal mortality. So what was the progress? On 2011 DHS, the progress of contraceptive acceptance rate was around 29%. The contraceptive prevalence rate was 29%. And we conducted a mini demographic health survey this year, and it came up with a result which is very interesting. It came up with 42%. And no African country, even no country in the world, has progressed such fast on family planning methods.
The investment that we have done in children nutrition, in disease prevention and control, and in immunization, and so on, would definitely have a high impact, a high return on the economic and social aspects of the country. A healthy child has better cognitive development, and a child who has a better cognitive development does better at school, and they are healthy, and finally they are productive.
Helping communities to keep their hygiene and sanitation is the other major task of health extension workers to prevent communicable diseases. The society is now developing awareness of standard procedures of latrine use to prevent food and water contamination. As a result of lessons taken from the health extension workers, people in the rural areas are adopting the culture of hand wash after toilet use. The Health Sector Development Programme, which primarily focuses on prevention, has also achieved notable improvements during the last 5 years in the prevention and control of communicable and non-communicable diseases such as HIV/AIDS, malaria and TB.
The very important intervention on HIV is the antiretroviral therapy. So on this therapy, Ethiopia is successful to enroll currently on more than 343,000 people in the program, and the ever enrolled number is about 700,000. So this number, shows you the availability of care and treatment for HIV.
The good news for the country is the auspicious result obtained in reducing the incidence of adult HIV infection on account of various interventions.
The HIV prevalence has dropped to 1.1% among adult population. It was 6.6% in 2001. Moving from 6.6 to 1.1 in almost 10 years. So we have to acknowledge the efforts and congratulate the Ethiopian government and the Ethiopian people.
Another target in the GTP is TB control program, which is characterized by early detection of new smear-positive TB cases, with an international standard set out to be 70% and treatment success rate 85% respectively.
TB case detection is being reviewed now and then. Some of the issues are related with the quality of laboratory services in the country, and it needs some, but the other and main reason is because people are not identified. People that have cough for more than two weeks should have the proper TB test, and that's not happening. So, there are different reasons behind that, how they are identified within the community, and even after they come to the facility, are they directed to the TB, the appropriate tests, or are they just treated with some other drugs and they are sent back home?
Whilst the country is striving to achieve better results in TB case detection, the achievement registered in treatment success rate exceeds that of the target set. For such reasons, deaths caused by TB have dramatically declined in the country.
First is that every year, and we know, there are less people having TB in this country. There were 346 people per 100,000 population in 1990. In 2012, the number was 240 people with TB per 100,000 population. So you see that is evidence based. And also in terms of mortality. Now is 18 death per 100,000 people. That's a commendable efforts. And Ethiopia has achieved the target of 50% reduction about death related to TB.
The other priority area of the health sector development programme is malaria prevention and control. The government has been taking various measures that have helped to significantly reduce the incidence of malaria outbreaks. One of the measures was the distribution of insecticide-treated nets in malaria-prone areas in the country.
More than 20 million nets were initially distributed for free, and they were regularly replaced, and that had increased the chance of having a high level of incidence to a maximum level. We had also community-based activities such as the insecticide residual spraying. So in malaria-prone areas where malaria is caused frequently, all households has been treated with this insecticide spray.
The Ethiopian government believes that investing in health is building a healthy and productive citizen able to realise the country's economic transformation.
Investment in health is multidimensional and is complex, and you see the impact in the long term. People expect that you invest here and you have to see the impact here. That's not actually the case. As I said, it's multidimensional, it's complex in its long term. And if you're thinking of the long-term impact and contribution of investing in health, then you definitely see it in terms of having, as I said, a healthy, prosperous and productive citizen.
We rely on the commitment of the government and on the leadership of the government of Ethiopia. But also, we want to highlight that partnership is needed to get more fundings, more resources, financial and technical resources. Partnership is key and should be at the center of this, how to deal with this challenge. Partnership between the government and the people of Ethiopia.
Looking ahead, the Ministry of Health is embarking on expanding health infrastructure, fulfilling more health facilities, building the capacity of health workers to ensure efficient and effective health services and sustaining effective health intervention programme.